Hi, this is Victoria Smart, and today I'm going to be teaching post-operative exercises to my patient. First things first, this is Ted. He is my patient. Say hi, Ted. He's the best. I'm then going to check my provider's orders and gather my necessary supplies. Then I'm going to enter the room, provide patient privacy, and introduce myself to the patient and their family. I'm going to ask Ted to give me his full name and date of birth and verify using those two identifiers on his wristband. And then I'm going to perform my hand hygiene. I'm going to explain the exercises that we will be doing and gain consent from Mr. Ted. And then I'm going to assess him assess if he has any respiratory complications. My stethoscope here. Next, I am going to auscultate his lung sounds. Front, front, and the back. Okay, sounds good to me. And then I'm going to assess his ability to breathe deeply and cough. Next, I'm going to assess the risk for any thrombus formations. So observe each calf. Let's remove his blanket. I'm going to assess each calf for tenderness, pain, swelling, any warmth or drainage, and then I'm always going to check and compare either the legs or any side of the body, one side to the other side. Then if he has had a chest or abdominal surgery, I'm going to have him place his hands along the incision, or he can use a pillow, and he's going to cover the incision and kind of splint it while he's performing his deep breathing exercises. Next, I'm going to be teaching him diaphragmatic breathing, and I'm going to help him into a comfortable sitting or standing position. So we will go sitting today. And then I'm going to have him sit all the way on the side of the bed or the side of the chair. If he's sitting or standing, I'm going to face directly in front of him and instruct him to place the palms of his hands along the lower border of his rib cage, and his hands should overlap slightly so that the tips of his third fingers are just slightly touching. And I'm going to demonstrate this for him. I'm going to demonstrate everything for him so he can go ahead and see it before he performs it. I'm going to instruct him to take slow, deep breaths, inhaling through the nose and then pushing. He should feel his abdomen or diaphragm expanding every time he's inhaling. And then I want to have him fully exhale. Next, I'm going to ask him to take a slow, deep breath and hold it for about 5 seconds. And then I will have him blow his breath out using pursed lips like he's blowing out a candle. And then you want to repeat that about 3 to 5 times. Next, I'm going to have him practice these exercises, instructing him to take deep, slow breaths as if he's breathing kind of through a straw, and then just like I said, pushing it out with pursed lips like he's blowing out a candle. I'm going to teach him how to use an incentive spirometer. So that helps increase lung volume and allows more airflow to get into the lungs. So I'm going to instruct him and assume a Fowler's position. And then I'm going to have him exhale completely through his mouth and then place his mouth on the mouthpiece. Then I'm going to instruct him to take a slow, big, deep breath and maintain that big, deep breath until he can't inhale anymore, as if he's pulling through a straw. And then once we have reached the expected or total volume as prescribed by the provider, I'm going to have him fully exhale out and ask him to perform this in a teach back so he can continue to use this in when I'm not there or everyday living. I'm going to determine whether he's able to achieve and reach that target volume, and I will note that in the MAR. And then I'm going to ensure that each of the exercises happens at least 10 times during the hour. So even if I'm not there, I'm going to ask him to try to make sure while he's awake to do it 10 times an hour. And then I'm going to teach him how to turn himself in bed. So I'm going to instruct him to lie on his back and move forward to the side of the bed. So we put him this way. Put him all the way on the edge of the bed. And then I'm going to instruct him to keep his legs straight and his knees flexed up. I'm going to instruct him to turn every 2 hours while he's awake, moving from side to then his back to then the other side, and he should be doing that every 2 hours. Next, I'm going to teach him how to do leg exercises in the bed. I'm going to demonstrate, obviously, all the leg exercises that I'm going to be performing passive range of motion on his leg. We're going to rotate each ankle in one direction and then in the other direction, opposite. I'm going to ask him to create imaginary circles with his big toe, and then moving both feet at once, alternating dorsiflexion and plantar flexion. I'm going to tell him that he should feel his calf muscles contract and relax alternately. And then next, I'm going to teach him how to exercise and perform the quadricep exercises. I'm going to set the exercises by tightening the thigh muscle and then flattening the knee. So fully extended, tight thigh muscle, flat knee. I'm going to teach him to alternate raising each leg from the bed, and then have him begin with the legs straight, and then as it raises, bending the knee. Instruct him to practice the exercises continuously throughout the day while he's awake, even if I'm gone. And then help him back into, after all the exercises are done, we're going to help him back into a comfortable position. Place the call light within reach. Make sure he knows how to use the call light to call me. And then I'm going to make sure all of his personal items are within reach, that the room and bed is tidy, and I'm going to perform my hand hygiene on the way out and document and report any findings of unexpected or expected outcomes.